Hello, my name is Deborah Akobi, and today I'll presenting my evidence-based practice based on improving ovulation and fertility outcomes in women with polycystic ovary syndrome using a structured lifestyle-based weight loss intervention. To start, I'll briefly explain what this presentation will cover. In this presentation, I will walk through my evidence-based practice project step by step. I'll begin by explaining the clinical problem of PCOS-related infertility and why it matters in women healthcare. Next, I will summarize the research evidence supporting lifestyle-based interventions as first-line management. I will then describe the proposed solution, explain the change model used to guide implementation, and review the resources evaluation plan and expected outcomes consistent with evidence-based practice principle outlined by Manick and Fenner Overhauled 2019. With that in mind, let's begin by looking at the problem itself. PCOS affects up to 13% of women of reproductive age and is one of the leading causes of anovulatory infertility. Many women with PCOS also struggle with overweight and obesity, which worsen insulin resistance and hormonal imbalance. These factors significantly interfere with ovulation and infertility and increase long-term metabolic risk. Johan et al. 2022. Although this condition is common and well understood, the way it is managed in practice reveal an important gap. Describe, Despite strong evidence showing that lifestyle modification should be the first line therapy for PCOS, many clinics rely on inconsistent counseling rather than structured program. As a result, care often shifts quickly to medication or assisted reproductive treatments. This represents a missed opportunity for early preventative intervention that could improve fertility outcomes as emphasized in current international guidelines. 30 or 2023. This gap in care led to the development of my project question. Guided by a Pecot question, this project examined whether a structured lifestyle-based weight loss intervention improves ovulation frequency and menstrual regularity in women with PCOS compared with usual care over 6 months. These outcomes are clinically meaningful and align closely with current evidence-based practice guidelines for evaluating intervention effectiveness, meaning Fenton Overhaul 2019. To support this question, I reviewed the best available research evidence. High quality research evidence support lifestyle modification as first line management for PCOS. Randomized control trials in systematic reviews consistently show that dietary modification, physical activity, and behavioral support improve guidelines to emphasize lifestyle intervention as founded therapy for women with PCOS. Terry et al. 2023 and Gordon et al. 2025. Some of the most important findings from this research are worth highlighting. Research demonstrates that even modest weight loss of 5 to 10% can restore ovulation, improve menstrual regularity, and reduce insulin resistance in women with PCOS. Studies also show that multi-component programs combining nutrition, physical activity, and behavioral support are more effective than usual care alone. Sharma or 2022, Teden or 2023. Based on this strong evidence, a clear solution emerged. The proposed solution is a structured, multidisciplinary, lifestyle-based weight loss intervention delivered within a routine health women health clinic workflow. This approach standardizes care by combining nutrition support and that is aligned with evidence-based recommendation, identifying lifestyle intervention as the cornerstone of PCOS management, TDR 2023. To guide implementation of this solution, a structured model was selected. The IO model of evidence-based practice guides this project by first identifying the practice gap, then confirming the organizational priority, appraising the evidence quality, the intervention, and sustaining successful outcomes. These frameworks support consistent implementation and helps translate research evidence into routine clinical practice. Many final overhaul 2019. Next, I'll briefly discuss the resources needed to make this intervention feasible. This intervention is feasible because it uses the interdisciplinary staff and requires minimal equipment. Personnel include nurses, providers, dietitians, dietitians, behavioral health professionals, and physical therapists with costs primarily related to protected staff time rather than new hirings. The estimated total project is approximately $8,700. The project follows a 9-month timeline, including preparation, a 6-month intervention period, and outcome evaluation. Potential barriers include clinical time, clinician time constraint, and patient level challenges, which are addressed through leadership support, standardized protocol, telehealth option, telehealth options, and integration into electronic health record. Consistent with evidence-based implementation strategy, Bennett and Fennell overhaul 2019. To ensure the intervention is effective, a structured evaluation plan is essential. Evaluation includes baseline, 3-month, and 6-month measurement of evaluation and weight outcomes, along with ongoing process monitoring. Monthly data review allows timely adjustment to improve adherence, address barriers, and maintain fidelity, supporting continuous quality improvement and implementation science principles. Scaviston et al. 2024. In conclusion, PCOS-related infertility is a significant clinical issue, and a lifestyle-based intervention are evidence first-line care. This project demonstrates how a structured approach guided by our model can improve consistency, outcomes, and sustainability in women's health practice. Thank you for your time, and I'll be happy to answer any question you might have. So these are the references, so feel free to go over them at your convenience. Thank you.